Okay, Lucy, well, we've completed the eye exam now, and I just want to take a minute to answer any questions that you may have.
Okay, how long will my eyes stay dilated for?
Well, in general, the eyes will stay dilated for about 4 hours, but sometimes patients will stay dilated through the next morning. So if you're still dilated later on this evening or the following morning, don't worry about that. That would be considered normal.
And when can I go back to the gym and exercise?
Well, again, it depends on the procedure that you've had done, but usually after surgery, we like you to curtail your physical activities for at least a week or two. But if there's a specific exercise you're thinking about, we can address that specifically.
And what about resuming driving?
Well, we would like you to bring a driver with you to your appointments because at every appointment you will be dilated, so it's dangerous to drive with dilated pupils. Following surgery, again, you'll always be dilated, so we would ask you to bring a driver. In general, in New York State, to drive with a license legally, you need 20/40 vision or better. To drive with a limited license, you have to have 20/70 vision or better. And that would allow you to drive to your home and drive to work and to drive within a 5-mile radius of your home.
Can I smoke?
No, 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 no. Smoking is very bad. Not only is it irritating to the eyes, but it also can exacerbate many eye conditions, including age-related macular degeneration and diabetic eye disease.
And this might sound like a personal question, but when can I resume sexual activities?
Well, following surgery, we would like you to be cautious. So we would try to ask you to limit your sexual activities.
And what if I have like a vacation plan? When can I go back traveling?
Well, we discourage traveling at the time of surgery only because we'll be seeing you a lot in the first few post-op days. And if you left and had a problem, then it becomes very difficult. So in general, we would advise you to postpone your trips for ideally 3 months. And if you have a gas bubble inserted in your eye, then you can't fly for 1 month because the gas will expand and that will cause damage to some of the structures within the eye.
And how long will I be out of work after surgery?
Well, again, with retinal surgery in general, it's really good if you can take at least 1 week off. We understand that everyone has a different job and different responsibilities, so we'll work with you to determine what would be the best time for you to resume to your normal work activities. If you have gas in the eye, typically it's going to be longer than 1 week, usually maybe 2 to 3 weeks.
Okay, and what about taking a shower?
Well, certainly take a shower before surgery and make sure you remove all your eye makeup. Following surgery, you can also take showers, but just try not to get the water directly into the eye because it'll be irritating and can also be a source of infection.
Okay, thank you.
Oh, you're welcome.